Egyptians estimate the time of gestation from 271 to 294 days compared to the modern count of 282 days from the onset of last cycle. A medical pathway is present prior to labor. She specializes in women's health, particularly in the areas of gynecology, gynecological disease, fertility, pregnancy, and contraception. She contains remedies for contracting the uterus, expel the placenta, and to return the uterus to the pre-pregnancy size, but says nothing about the normal conduct of labor or perform surgery. Midwives are used for the labor process in this culture, and there are two helpers to assist with the birthing process. These helpers provide emotional support, encouragement, medical care, and religious help. The helpers have no formal training because knowledge is passed down from the previous generation. According to research, traditional birth attendance attends 42% of delivery in Egypt, and 60% of deliveries occur at home, suggesting that effective training and supervision in essential maternal and newborn care could have had far-reaching effects.
Hi Sheba, how are you?
I'm a little nervous about this labor, but besides that, I'm okay.
Well, you'll be fine. I know that last time you came, a little over a year ago, you came in for fertility treatments. And we mixed a mixture of frankincense, oil, and dates. And now, you were able to conceive.
Yes, look at me. I'm about to have a baby.
That's excellent. About 6 months or so, I gave you a plant with seeds, and I asked you to urinate on it in the morning so that we could tell if you were having a boy or a girl. Did you bring that with you?
Yes, I have it right here.
Excellent.
Seems that I'll be having a girl since the barley grew and not the emmer.
Wow, that's exciting.
Delivery takes place in a confined pavilion with columns decorated in vines. A mattress, headrest, mat, cushion, and a stool are arranged in the area. At delivery, only females are present. The midwife Isis and two other women chosen by the pregnant mother. In this case, they are her servants. Our book mentions that this culture forbids any male other than the husband to see an uncovered woman, so the nurse should ensure coverage of the woman whenever possible, even during vaginal exam and the second stage of labor. Examination should be done by a female nurse, physician, or certified nurse midwife whenever possible, because many Muslim women are not comfortable in the presence of male physician or nurse. If a male physician is involved in their care, they may wish for their husband to remain in the room during all care by the physician. Male providers should only enter the room only after receiving permission from the husband. Modesty needs vary, and each individual will need to be assessed. Family support may be particularly important during the labor process, but it does not preclude the importance of the nurse's presence.
Hello, Sheba.
Hi.
My name is Iris, and I will be your midwife. These are my two assistants.
Hi Sheba, my name is Teresa.
Hi, my name is Anne.
And I have brought hot water for you, so the vapors can help aid you in your delivery. Okay?
Hi Sheba, I was also called to come and help you stay strong. Okay. This is a magic ivory wand, and as you can see, it's decorated with ivory, lions, crocodiles, and snakes. I'll place this on your stomach to make your heart stay strong and the baby to stay alive. Getting pregnant and childbirth can be very difficult and dangerous at times. So I'm going to cast a spell on you so that your labor will run smoothly. Okay?
Thank you.
Okay, here's your magic wand on your stomach.
I was called upon to help you with your pain, and I could soothe your pain with blowing air on your stomach. And if you allow me, I will let my lucky child on your brow, and it will bring you luck and health. help you with your labor.
Okay, thank you.
Okay, let's go ahead and start this and have this baby out, okay? All right.
The delivery begins to progress, and eventually the child rushes into Icy's arms.
Oh my gosh. The baby's bones are very strong. I'm gonna go and wash them and wrap them up, okay?
Apparat can be trained to monitor labor, to avoid interventions that speed delivery, and to provide effective resuscitation. Additionally, dyads can be trained to identify high-risk newborns. Clean delivery could be improved. In almost half of the cases, delivery instruments were not disinfected, and aseptic care of the umbilical cord was lacking. Suboptimal practices included lack of disinfection of delivery instruments, unhygienic cord care, lack of weighing of newborns, and lack of administration of eye prophylaxis or vitamin K. According to research-based evidence, 1/3 of complicated deliveries occurred at home, commonly attended by relatives, and the umbilical cord was frequently pulled to hasten delivery of the placenta. In facilities, mothers reported frequent use of forceps, and asphyxiated neonates were often hung upside down during resuscitation. Consequently, high rates of birth injuries were reported.
Hi Sheba, how are you?
I'm better now.
Feel good?
Yeah, a little tired.
Okay, well Iris told me that you have a tear on your perineum, so I brought you some oil, and I want you to soak it on there, okay?
Okay.
Do you have any other questions?
No.
Okay,
Thank you, Medical Pathway.
you're very welcome.
Hello, Shiva. Your baby is healthy. You can have your baby now. When you and your baby are both healthy, then you can take your baby home. It is very important that you start feeding your baby now. Nurse your baby, love your baby. Okay? Nurse your baby for about 2 to 3 years, and then your baby will grow up nice and big. Okay? Do you have any questions?
No, thank you.
Thank you.
Cook mentions that most mothers of this culture breastfeed because the Quran encourages it until the child is between 2 or 3 years old. The medical papyri during this postpartum period can be trained to also encourage immediate mother-newborn contact, which prevents hypothermia and encourages skin-to-skin positioning while breastfeeding.
Maternal mortality in Egypt is still relatively high, so the most effective way to prevent maternal death is to have deliveries attended by personnel who can recognize and treat or refer any complications that arise. Skilled personnel include health professionals, such as physicians, nurses, and midwives. Moreover, nearly half of mothers were going through their pregnancies without any antenatal care. Therefore, the interventions paid special attention to OB care and neonatal emergencies. They included extensive training, needs of assessment, detailed situational analysis, and community diagnoses. A woman's death may be avoided if she receives sufficient antenatal care to identify potential problems, or if midwives diagnose complications sooner. An Egyptian study showed that women who suffered OB hemorrhage and were put in a neoprene and Velcro device, much like the bottom half of a wetsuit split down the middle during labor, decreased by 50% as compared with women who did not use this sort of device. When in shock, the brain, heart, and lungs are deprived of oxygen because blood accumulates in the lower abdomen and legs. This device returns blood to vital organs and restores a woman's consciousness, pulse, and blood pressure, while slowing blood flow to the lower body and decreasing bleeding. After a simple training session, anyone can put the garment on a bleeding woman. Once her bleeds have stopped, she can safely be transported from a home birth or primary health care center to a referral facility for emergency OB care.
Many Muslims from the Middle East may use birth control but do not believe in sterilization because it is a permanent method. Other Muslims may not practice contraception because children are highly valued and it is believed that the traditional role of the woman is to bear children. Until the 20th century, contraception in the Egyptian culture was performed by the insertion of oil, honey, and natron into the vagina. When this mixture was dissolved, lactic acid was produced.
This was a very effective method for making what is known now as spermicide.
Our textbook mentions pregnancy is a joyful event in this culture, and it also states this culture places a high value on children. However, pregnancy is a shameful event if it occurs outside the marriage. In many Muslim countries, an unmarried pregnant woman may seek a clandestine abortion. The consequences of carrying an illegitimate child can be social ostracism or even death in some cases, even when the pregnancy has resulted from rape. It is not unheard of for a woman to be killed if the family discovers that she engaged in sexual intercourse outside of marriage and became pregnant.